energetic. In terms of the professional life, I have a bachelor's in cell molecular developmental biology from UC Riverside and an MBS from KGI. My consulting experience is market access, different types of market research, and competitive intelligence. Happy to answer any questions on those at the end. Great. So in terms of kind of that professional experience too, it all started, in my opinion, in undergrad, where I studied science, moving into KGI. After KGI, I joined a small firm called Life Science Dynamics, roughly 40 to 50 people, moved to San Francisco. So was very excited about that. Still based here, switched over in the middle of the pandemic to Syneos Health, and currently been with them for a little over a year and a half. Great. So yeah, just want to start off by, really going through my experience at KGI. I know some people might be or very on in their decision of whether to come to KGI or have already committed and want more guidance on what to do. So my experience is coming from the MBS side, and as the highlights, I've listed some of my favorite classes, the ones that I feel like were very impactful in different ways. So the first is the Introduction to Bioscience Industry. I think that class is crucial because it really introduces you to different situations that these pharma and diagnostic companies encounter. And it really challenges you to think of the situation holistically. You get to be in groups and speak in front of your peers, have feedback from the professor. So it's a really great class that I feel like you learn a lot from. There are times where preparing for interviews, I have gone back to the book and practiced some of those cases just to kind of really apply the skills that you've learned through the program. Next is the industry internship. This was a really big experience for me because it was the first professional job really. It was a 3-month summer internship that I'll go into in the next couple slides too. But that's a great advantage of being at KGI and in the MBS program, because you don't get matched, but you do have the opportunity to have a paid internship, which is great, and not necessarily at other schools too. Lastly, well, second to last is the Team Masters project. This is the single most important class and project that you'll be involved with at KGI as a master's student. So what this is like anywhere from a year to a year and a half long project that you're really involved with a liaison to kind of solve a problem. So ours in particular was market research. I'll go into a little more detail in the future slides, but this is a great experience. I think getting ready for meetings, planning against timelines, and really tying everything together at the end. There's no greater experience than that, I think. And coming into the actual professional world, those kinds of skills, like you can hit the ground running pretty much to different extents. Lastly is the applied entrepreneurship class, and this is in your second year at KGI, I believe. And this is another one of those classes where you're tying together a lot of what you learned in an applied way, working on a project with a client, also kind of like a liaison to, again, solve an issue, whether it's a business plan or actually typically it's creating a business plan for them for some kind of opportunity that they're looking to get more information on. So tying the whole picture together, we'll walk through some of that too. So some initial takeaways, I think, that I wish I would have known back entering KGI would be, really relying on your peers and just making sure to be part of the community. I think there's always opportunities to really focus on your work, take on a lot of work, really just kind of look out for yourself, which is okay too. But they're going through the same things with you, probably have similar goals too. So, you're in it together. The next is probably this idea of like not being perfect, not seeking perfection, really important because it's a learning experience the entire time. And the last point is that the long road, I think, is more scenic. There's chances to get somewhere quicker, but I think to get there together is a little more fruitful in a way. You learn more, you get to see more, and appreciate it as well. Thanks. Right, so a little bit about the industry internship. I got my internship at Ventura Medical Systems. This is a subdivision of Roche Diagnostics, and they focus on clinical scale tissue diagnostics. So those large machines that are high throughput, and you can see some of the tissue scans they have up there. They also do the stains too. So it's kind of the complete package. And my role there was a marketing intern. So I was able to move out to Tucson, Arizona. That's where they're based. I had never been out there, and it was a paid internship. So room and board was covered with the not the salary, but the kind of the wage that they were giving at the time. So that was a great experience. I was able to spend. It ended up being 12 weeks out there, and great. It was part of the Summer at Roche intern program, where there's kind of like weekly meetings. You check in with your assigned boss often, and you get a lot of exposure to the other management there too, if you want to. There were times where I would ask people random questions, and they were really nice and would answer them right, like, who's this person coming up to me? You didn't get any of that. It was more of like, just schedule some time, or can we do this a little later? But then they would always circle back. So I always remember I had this one finance manager who, like, I didn't know much about finance at the time, and he was just like really cool and talking to all the interns, and he sat us all down and walked through like where Ventana sits in the entire Roche organization. And that was such a great experience to have, because he didn't even know about my TMP, which ended up being with another Roche division too. And it really painted a good picture for me. So I appreciate things like that. In terms of what my project was, the overarching project was to create an internal website, so only seen by people at Roche, and create a place where their regional marketing and sales teams can come and find resources that the global team has sent out. So this Ventana team in Tucson was the global team, and they would put together marketing materials. The people I would work for would do the strategy, but mainly start supporting the regions in whatever way they need, whether it's like an event or the actual promotional materials too. So we made that together with the IT team over there in Tucson, had a couple meetings with them. And that's part of the advantage of the internship, is like, it is what you make of it. I was able to go and like set these meetings myself, and was responsible for carrying it through too. So towards the end, finished a little bit early, and there were a couple other things that they had me do. So one of them was kind of walking around and reaching out to each of the product managers and who was responsible for a type of assay, and have them provide the most up-to-date information. The last thing was also kind of taking account of their social media coming out of the tissue diagnostics division, and show kind of what some of the metrics were for their I wouldn't call them campaigns, but for the different materials they left. So it was like YouTube, their Twitter. I believe there was one more, but kind of down that realm of like, what were the views? What is the type of content that we've been putting out, and when? So that's something I helped them with too. Great. So next is this Team Masters project, the TMP. And I started my TMP in the second semester of my first year. So it ended up being a year and a half, where typically it's about a year. And I was paired with Roche sequencing solutions, so also part of Roche Diagnostics. And our job was to research these three topics and perform primary research, which means hearing directly from the source and not doing what's called secondary research, and that's like published or secondhand information. So there are a couple ways to do primary research. Most often you hear about in-depth interviews, and that's one-on-one. You prepare a list of questions and you just kind of run through the interview to answer whatever your questions or your research topics were. Another way you can do it is focus groups, surveys. There's a couple different ways you can do this, but we relied mainly on in-depth interviews for this. So each semester we sort of tackled one of these technologies, and what our main goal was to kind of get ahead of the ball and see how researchers and companies were thinking of these and whether they were going to be actual kind of opportunities in the future. So these are like cutting edge technologies. Sequencing itself is a very new field, especially in terms of its clinical applications. So a lot of what we found was like, this is great, this is extremely innovative, but there are going to be some commercial hurdles for it. So we ended up, if we add up the 3 semesters, it ended up totaling over 70 interviews that we did. And we also put together a survey during, I believe it was the last project, to test that out as well. We worked with the liaison. He was walking us through market sizing that he was doing, so we were exposed to that. We also did literature reviews in the background to understand what the technologies were and some of the applications in diseases. Because we in addition to like holistically looking at the technology, we also wanted to see which of the applications were also most viable. So that's a lot of what we worked on there. And then in terms of the logistics, we did regular check-ins, weekly or bi-weekly, and then we had the opportunity to go out to Pleasanton to give our final presentations, which was really cool. Nice. So lastly, this is again at the end of my KGI experience, tying it all together, this applied entrepreneurship class, which was a ride to say the least. So this project you work on for most of the semester, and as I mentioned, it's a business plan project. So all of the different components that a business plan has, the marketing, the finances, the operational planning, and then your executive summary, and everything in between, really. So we worked with this company called Claremont Biosolutions, and they were, I would call them more of a startup or a very small biotech. And they had this technology that was very early in its development and had some government funding grants, some family and friends, I believe, at the time. So what they were interested in is whether their technology could be used as a service instead of selling it as a product. So we kind of walked through the whole gambit and did our best to really plan out what it would look like if this was a service based on I think the best part was that in the MBS program, you take a couple diagnostics classes, which are very important, whether it's your interest or you're more interested in the medical side, but they're extremely crucial in terms of the clinical application. So we were able to tie in or make sense of what their technology was at least, and build from there, which was, I think, could not have been done without that foundation. And in addition, there was also the advantage of the TMP experience, of the internship experience that really lets you kind of challenge yourself and put out the best plan you can at the time. And you have a team of 3 or 4 other people helping you. You can either learn a little bit about everything or kind of specialize in a certain area, depending on what works best for you all. So I think that's about it in terms of the slides I prepared. I'll open it up to questions. I have a couple other slides if anyone's interested in my time at Riverside, my time at Syneos, or Life Science Dynamics, but I'd really like to leave this up to you all. So I'll go on mute for a second and
I had a question. What is it that you enjoy about this job?
my current job.
Yes, sorry. What is it you enjoy about this career?
Yeah, so I initially joined consulting because I wanted to learn a lot about different project types. Coming out of KGI, I was really interested in market access, which is kind of an intersection of reimbursement, pricing, depending on what organization you're in. So I wanted to learn more about that. I think I'm very passionate about improving access, understanding what the barriers are for different products, and just kind of learning about it at that basic level. So that's what drove me to do this. In terms of what's next, I'm kind of enjoying. There's still a lot to learn from different like reimbursement in hospitals versus outpatient. There's a lot to learn. So I think my passion for access is still there. If that answers your question.
Yes, thank you very much.
I have a question. Hi, Nick. I'm Elizabeth. I'm the KGI Officer of Alumni Engagement. So my question for you is, when you went from Roche to Ventana back to Roche, was it kind of like the same organization because Ventana is part of like Roche? Was it like the same feel, or was it kind of like you were going into two different systems of databases or management or anything like that? Can you talk about like if it was similar or different or stuff like that?
Yeah, I think I can speak to it from a kind of removed way because I didn't, for the TMP, we didn't use their like websites or their databases, but I felt like the culture was really similar. Very motivated people, a lot of experience, and they were willing to help too. I think that's kind of applicable to anywhere, but when you feel it, you kind of feel it, you know what I mean? So in some ways there was the same, but they work completely separately. They're not sort of working on similar products or like merging them together at this point. That's like a specialist team's role. So I'd say for the most part they're separate. They're separate.
Thank you.
And just as a note, if anyone has any questions, but they maybe don't want to talk, you can go ahead and throw them in the chat and I'll read them for you, just as an option.
I had a question about, I guess, kind of the process of uh, what you were talking about, that when you were working with the Roche teams, what kind of work, or what, I guess not the workload, but what kind of work, I guess, specifically do you do inside of those projects, and how does it differ from project to project?
So I believe you're referring to the TMP, where we worked across like 3 separate research topics.
Yes.
Yeah, good question. Good question. So, for the most part, the in-depth interview process was the same. We The important pieces of doing that type of research are your sampling, and then your kind of instruments that you use. So typically make a discussion guide, some stimuli for people to or for the respondents to read and to be able to rely on if you're testing something in particular, like a message or a product profile. Those aren't things we did, but you do use stimuli. And then there's typically some kind of data capture. So you can refer to it when you're writing a report. Those components were the same, but the discussion guides were fully customized to the topic. Not going to be asking the same questions every time. Aside from that, like the other pieces, the market sizing, we only did that one of the semesters. The literature review, again, like kind of always there, but to different extents and looking for different publications as well. So yeah, hopefully that's enough detail.
Definitely. Thank you very much.
I have a question. Someone messaged to me and they asked, what do you feel was the most important in securing your first internship?
That is a great question because I actually found my internship pretty late in the process. It was already, I believe, starting summer or like the last week of school, where I was still kind of had some applications out and hadn't secured one yet. And finally, I got a call. So I think my advice would be first is like make your application process targeted in a way. Like really think about what you want to get out of it and how you're going to use this like 2 years down the line. And then also if you're sort of hitting the roadblock where you're getting a couple no's or no responses or just having trouble finding what you want, I would say just don't give up. Start as early as you can and don't give up. Those would be my 2 pieces of advice.
I have another one that was messaged to me and they asked, what was your time at UCR like? Did you participate in research there?
Yes, I did. And that was a great experience too. So I was at UCR for 4 years. In halfway through my first year, I just like had a random opportunity where there was a TA who was looking for help in her lab, and I was one of the volunteers. Went through like a selection process, and I ended up sticking with that lab for 3 years. And then things just kind of didn't work out and I couldn't continue, but I learned a lot, was able to present at conferences, get that speaking experience and getting over those fears, and being able to kind of summarize the research process too is super helpful. Any other questions? Now we're running kind of fast on this one.
Okay, we got one. It says, what is one piece of advice you would give to people who want to work in the pharma entrepreneurship space?
That's a really good question. The one piece of advice that I hope we hear more about is this like idea of patient centricity. And what I mean by that is like the business aspects are very important. Those are the moving pieces to kind of get some of these medicines, these products out and functioning in the world. But in terms of the like creation process and what's motivating people to do their best, I feel like should always come back to why it matters and who is this impacting? Is the evidence for this product enough to make a difference? and am I making a difference? Honestly, there are times where that's almost taken for granted, or just not really appreciated. And I think that that's a really important part of being one at KGI, honestly, because it's health centered, but also in healthcare in general. Um, it's not just for job security, especially if you're getting a master's degree in it. I think that passion sort of speaks for itself in learning more and applying more and being a good team member and things like that. So that would be my recommendation: is always bring it back to like, why are you doing something? Who is it for? And how is it going to help them?
Do you want to maybe go through your last couple slides that you had and see if any other questions
Yeah,
arise?
sure. Let's just jump to the Syneos one, if you don't mind. Great. So I just want to spend a little time talking about my recent experience here. I'm not sure if many of you have heard of this company before. It's a very large company. They have a global presence. Their main focus is on commercial research, or sorry, clinical research. Um, so running clinical trials, planning them um, in all different countries. So that's the majority. But I'm part of the consulting team, which is like a couple hundred people, and do all types of consulting. They do commercial, they do risk management, um, we do market access, and what we call value. I'm trying to think. There's also medical consulting. It's kind of like medical affairs, but a little bit more evolved. So it's pretty much the I guess the value proposition would be that it's a one-stop shop if a company needs, if a biotech or pharma company needs kind of all the services, or we have the capabilities to do or support whatever function they need. So as I mentioned, I'm part of the market access group. What we do is reimbursement, pricing research. There's a communications piece as well, understanding how to engage with payers, what messages are effective, and what they really care about, which is a component of like having a successful drug in the market, or having a successful you know, uh, product as well. So some of the tools that you'll learn at KGI are frequently used. The market research piece, it's not just interviews, but there's a lot of reports that you need to go through. Sometimes you'll be asked to read the literature to get up to speed very quickly. And you also have the opportunity to kind of, if you have an interest in, say, pricing, can kind of ask upfront to have some preference to be on those projects and learn some of those skills. And if you're interested in the other verticals as well, I think can kind of guide you to the right people too. So it's a great experience. I think you learn about the different, what we call stakeholder groups. So like who's involved in that situation, like what types of doctors, what types of hospitals, and also what type of reimbursement agencies are involved too, depending on the scope. So it's a really great learning experience. I think there's never going to know everything, but the important piece is like always wanting to get better and put out the best project you can. Any questions on Syneos or anything I just said? Nice. Well, if that's all, thank you all for joining. I mean, I hope this was helpful in some way. My contact is in the back in case you have any questions. Very happy to answer anything about KGI or early planning in your career. I'm still very early on too, so wasn't too far away from probably where you're sitting now. So no worries. I'm happy to respond. And yeah, is there anything else we should do at this point?
No, I mean, if anyone has any other questions, I just put your email in the chat so that you guys have access to it there as well. But yeah, we can wrap up early if no one has anything else to say. Thank you so much, everyone, for coming. And yeah, we'll maybe see you at another speaker series sometime.
Thank you.
Thank you.
Have a good weekend.